Hi, I'm Dr. Jeffrey Moreno from Bellissimo Plastic Surgery and Medi Spa. Thank you for joining us at our Facebook Live event. Today's event is dedicated to Amanda Papp. She just joined us 3 months ago. Amanda is a PA, and I'm going to introduce her, so welcome. And I want Amanda to tell you a little bit about herself and her background, and then we'll go into more about what she's going to be doing here, and we're going to do a Botox demonstration as well.
Yeah.
So welcome.
Thank you. So my name is Amanda, as he said, and I am new to the Bellissimo family here, but not new to the industry. I am a physician assistant or associate that has been in the industry for a while, doing a spectrum of things, all from injections, post-op care, laser treatments. I first assist in the OR and do many non-invasive and minimally invasive procedures. So I'm excited to get to know everyone at this family here, and excited to do some live injections.
So Amanda comes to us with about 10 years experience, ranging from pediatric plastic surgery, cosmetic plastic surgery, also reconstructive plastic surgery. So all 10 years have been dedicated to plastic surgery, correct?
Yeah, I don't know what else I would do.
So, but basically Amanda's going to be at both of our main locations in Shadyside and in Monroeville. She's going to be seeing patients that for Botox, disc support, dermal fillers. We're also going to have her brought up to speed on some of our latest devices and the lasers that we have. She is also very adept and excellent at removing skin lesions and moles, skin cancer. So she's going to be doing that as well as me. She will be seeing some of my post-op patients at certain times, so patients that are coming through the practice for me will also get to know Amanda. And so she's really going to be my right hand. We're going to be doing a lot of minor surgeries together in the office. She's going to be helping me at the surgery center at times and also in the hospitals doing procedures. So I'm really excited to have her here, and I think she's really going to broaden our family and the practice. So we're really happy to have you. And so now we're going to talk about, as we seem to do with every new injector to the practice, I get to be, the guinea pig on Facebook Live. And so we're going to do Botox. The last time I had Botox was when we brought in Ashley. It was about 1.5 years ago. So I'm definitely due.
Way overdue. Okay, so we're just going to treat this like a consultation.
Mm-hmm.
So I'm going to ask you, what bothers you about yourself? What brings you in today?
Well, as my family sees that I do have some pretty prominent lines across my forehead, not so much in the glabellar area, but that I usually get that treated as well, but mostly just helps smooth out my forehead.
Okay. So there are 2 different types of neurotoxin that we mainly use, Botox and Dysport. You have a history of using Botox, so we'll stick with that. We'll stick with what works, but they both are neurotoxins that are injected directly into the muscle. And then over a course of about 7 to 10 days, that muscle will soften and relax, and then those overlying fine lines and wrinkles should therefore soften and relax. And the treatment should last about 3 months. Some people can get a little bit more with consistent treatments.
It might last 1.5 years.
There's very minimal risk. Sometimes you can have a little bit of pinkness at the site, sometimes a little bruise at the site, but it does take that full 7 to 10 days to kick in, although you'll start noticing in a couple of days that you'll have a nice, soft, refreshed, awake appearance.
That's good.
So the treatment itself takes only a couple minutes to do. People can come over their lunch break and literally do this. And so we had to sign all your consents and everything.
Right.
And so
I think one of the biggest questions that patients ask is what's my downtime and what are my limits and activities afterwards? So what are the things we always tell them?
Okay, so the day of the treatment, you're not allowed to go put any pressure on the area. I tell people, so no napping, no laying down, no massaging, no rubbing. If you're going to get any type of treatment, like a facial or anything, it has to be before Botox or Dysport. It can't be after. And no exercise that day. Nothing more than walking. You don't want to increase your heart rate. Just for potential that the medication could be moved and not where we want it to be. So activity level pretty low. The day after, you can go back fully normal, exercise and all your activities normal, and no
Right, and I think it's important that when you talk about exercise, no exercise before as well, because it does increase your blood flow, and you have a higher risk of actually getting a little bit of bruising from it. So
Right.
that's an important thing. So if patients are getting that in the late afternoon, when would they be able to comfortably, not worry about going to bed and sleeping at night or laying flat? How many hours?
4 hours minimum.
Okay.
Yeah.
Good.
So.
How important is it to get Botox injected by an experienced PA, physician, nurse?
I would say extremely important. There are a lot of people that will that will charge you and inject things in places that it's not appropriate. And so you just want to make sure you do your research, board certified plastic surgeon, and start from there and go follow someone or research someone that has a lot of not only years of experience, but just like a reputable reviews.
Yeah, I think this is one of the many things that when you look at online, social media, YouTube, I mean, it does look pretty easy. Amanda will show you tonight that it's pretty easy to do. It takes a few minutes, but there's a potential downside. And, when you're at an experienced place with good oversight, a good follow-up, those risks are minimal. But when you're with somebody who's not experienced, they can be they can go too deep, they can go against the bone, they can be injecting in areas that might have more blood vessels. So you just have to be very careful. Sometimes when you're starting to see some place with really discounted prices, these are the kind of things that are probably not in your best interest. But do your homework and look around. You should see a pretty good consistency of costs and how the Botox or Dysport is injected. And again, we've had good success with both of them. They're both excellent neurotoxins. But with you and all your background, Ashley and Pam, they all have a lot of background, and so the risks are small.
Is it painful to get the injection?
You're going to find out in a few minutes, or at least I'll find out.
Some sites are a little more sensitive than others, but no, it's very minimally painful. We typically do not do a topical numbing because it's injected into the muscle, and the topical numbing isn't going to get at that depth. But I give a warning before each pinch. And like I said, some are more sensitive than others. The eyes are a little bit, I would say, the most sensitive of the area, but we're not doing that today. So very, very tolerable, almost like some people say, like a pinch and burn feeling for like a second.
It really doesn't. I mean, it goes so fast. I mean, it's over before you know it. Honestly, you don't even really feel it. And even afterwards, it's not, you don't walk away and have pain. I mean, as you said, you can really have this and go back to work.
Will he still have mobility? Will the patient still have mobility in their face?
Yes. So we want you to still have movement and look natural. We don't want you to have like a frozen appearance, but the objective of this also is to make those lines go away. And in order to do that, you have to relax the muscle to some degree. So this is why it's important to go to an experienced injector, because where the medication is placed can determine that. So you still want that balance.
Can Botox or neurotoxin be used to lift the brows?
Yes, it can be. So again, this is something that there's a few places that you can specifically target to give that lift of brows. And depending on the patient, like if it's a male or female or younger or older, if they have any hooding of the upper lid or heaviness, baseline heaviness of the forehead, those are all things that go into factor when you're injecting, and that should be discussed during your consultation.
Right, and that's the other part of why you need to be with somebody experienced. A lot of times when patients come to see me about upper eyelid surgery, you have to look at the placement of the eyebrow and the upper eyelid, because that placement is critical. If you look at somebody's eyebrow that's higher or lower, it really affects the eyelid skin. The same thing happens when you do Botox, because it will soften that muscle's pull. And so if you're somebody who has a lower brow and you're really needing to lift that brow to see better, then Botox probably isn't the right treatment for you. And so you have to be with somebody who's going to look at that and assess it. Anybody can come in and say, oh yes, you have some lines, we're putting in Botox. And we've seen multiple patients coming in over the years that were probably misdiagnosed and were given Botox at an outside facility, and now are having issues because it probably shouldn't have been done on that person to begin with. So you really need to be assessed. It's not just something you come in just because you want it. You have to be assessed. A diagnosis has to be made. You want to make sure that everything is where it needs to be anatomically, and then it's safe to get it.
And obviously Botox is not just for women.
Well, no, Botox is still the most significantly asked for, and not just Botox, but we talk about neurotoxins in general now, but it's both for men and women, and there's more men using neurotoxins than you'll ever know. I like it when I do get around to getting it, and it does smooth out your forehead. It doesn't, there's really few hours of downtime. I've had it where I've just gone right back and seeing patients, so there's really not much downtime with it at all. It actually feels good once everything's kind of kicked in, and the look is very refreshing. So I think one of the other things we were just talking about is there is not much difference between Dysport and Botox, because patients will come in, especially first timers. What should I use? I had a friend that used this or a friend that used that, and as we were talking, I usually liken it to the patient as, some patients use ibuprofen, some get better results with Advil, some get better results with Aleve. They're all very similar ibuprofen products, very similar in that sense, but sometimes it might be more efficacious for that patient. So we don't really try to sway somebody one way or the other. If you're a new to neurotoxins, it just depends on what you want. Talk to the injector, and you guys can kind of decide which way you want to start. But either one is not a bad choice either way.
One of the main questions that comes up is the injectables in general get confusing as to an injectable product like Juvederm or Restylane versus Botox. Can you just give a short response to that?
Yeah, so Botox and Dysport are neurotoxins that are injected directly into the muscle and therefore relax the muscle and overlying lines and wrinkles. Fillers are dermal fillers, like Restylane, Juvederm, and their products are come in a syringe, and they're in a gel form. We use all hyaluronic acid based fillers, but there are others as well. And they're injected into the different layers of the skin, and some even deeper into like the fat and on the bone to help plump tissue. So it can help soften fine lines, but in a different way because it's plumping the tissue.
All right, are you ready for your procedure?
All right, I'm ready.
Okay. We're gonna take your glasses off. Pull this down.
All right.
So the day of the procedure, if you have makeup on, I typically take it off. But if you are coming from home, don't bother putting any makeup on. I always clean off with alcohol before. So the number of units that are used per site is going to vary per patient, but it's not going to vary drastically. Obviously, in men, they require a few more units typically than women because their muscles are a little bit bigger in some areas and stronger. So today we're going to do 21 units in the glabella for Dr. A and about 20 units in the forehead. And it's, again, that doesn't mean I had a patient today that asked, is that 20 pinches in those areas? No, there's a different amount of units placed. There's about anywhere from, I would say on average, about like 6 to 8 on the forehead, and typically about 3 to 5 in the glabella region. And like we talked about, there's not really much pain with the injection. So I usually give a warning before each pinch. I have you make some silly faces as I'm doing it, just to make sure I'm where I should be. Okay, I'm gonna have you turn your face a little bit to me. Okay, and I'm gonna have you make a mean face. Good, and relax. A little pinch here in the middle on 3. 1, 2, 3, pinch. And mean face again. Relax, pinch. And pinch.
Are you okay?
Yeah, honestly, you hardly feel it at all.
And 2 more pinches here, okay? One more time, mean face. Good, relax. And pinch. Pinch. All right, now we're gonna move to the forehead. Okay, and turn a little bit to me and raise your eyebrows up.
A lot of lines to hit.
Yeah. Turn a little bit more to me. Good. And relax. And 1, 2, 3, pinch. And pinch. And pinch. Pinch. Turn this way. Raise up. Relax. Pinch. Pinch. One more pinches and we're done.
And how long does this typically last?
It should last 3 months. Some people get a little bit more, like I said, when they've consistently been getting treatments, but 3 months is the average time period. And raise up, relax, and pinch, and pinch. That's it.
It's pretty easy.
Pretty easy. You're not gonna bruise at all. And you can barely tell. These little areas of pinkness should go away. I usually tell people by the time they get to their car, you could go back to doing whatever your normal activities are.
Now, what about ice?
I
Because
know.
some patients will ask about it.
Yes.
That's why I want you to
So
comment.
less is more in your theories and in mine. So some people will say, you need to make these expressions or whatnot, but I always tell people, it's where I place it, it's going to go into. I don't want you making any silly faces or doing anything special. Just let it be. Don't touch my stuff.
That's right.
And don't ice because, again, that's putting pressure on the area. So we don't want it to go anywhere that it's not supposed to. Just let it be absorbed into the muscle, and then the results will be obtained in a weekish. So you'll be good for the new year.
That's
Wrinkle
right.
free.
All right. Well, thank you so much for joining us, and I hope that you come in and meet Amanda. She's excellent, and I'm really looking forward to the future. We have a lot of good things happening here at Bellissimo. We're going to have some new announcements coming up, probably at our next Facebook Live. So we will see you in a month. And Ella is hard at work with some new projects, so we're ready to announce those soon. So everybody have a good day, and we will see you next month. If you have any questions at all, please give us a call, 844-496-6647. Follow us on Facebook. We have Instagram, all the other social media, so I can't remember. So, but you can follow us. But please, any questions, we'll be happy to answer them for you.